Hi guys, it's me, Professor Dia. Welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot and we're going to be covering age-related changes. These concepts are very important to know if you're currently in a nursing program or if you're studying for your boards. You need to know the age-related changes. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for private tutoring sessions. You can sign up for consultation session. My Nexus Nursing Test Bank is coming out. It's rolling out very, very soon. So keep an eye out for that. Lots of resources available if you're currently in a nursing program and you are struggling. You have to do really, really well on your next exam. Check out the audio lessons I have available and see if I have one that matches the subject matter on your next exam and thank me later. You can find me covering a variety of nursing topics across my social media platforms almost daily. TikTok, Instagram, Facebook, YouTube. My handle's the same everywhere, Nexus Nursing. So be sure to check that out. All right, guys, without any further ado, let's get started. Age-related changes. Okay, a nurse assesses the skin of an elderly patient and notices increased dryness and thinning. Why is this happening? Is it due to increased melanocyte activity? Is it due to decreased sebaceous gland activity? Is it due to increased collagen production? Or is it due to increased subcutaneous fat? What do you guys think? If you guys aren't in the Kahoot, you can answer on the live. You can still participate. Very good. Decreased sebaceous gland activity. So, guys, with aging, you're going to see decreased sebaceous gland activity, and that leads to dryness and just that skin being much more fragile, which puts that patient at increased risk for skin tears. Okay. It puts that patient at increased risk for pressure ulcers. So, you need to know that. Which of the following interventions is most appropriate for an elderly patient with xerosis? And I even told you what that is. That's dry skin. What's the answer? Encourage frequent hot showers, apply alcohol-based lotions, use mild fragrance-free moisturizers, or increase sun exposure. What do you think the answer is? Very good. Use mild fragrance-free moisturizer. So you want the moisturizer number one to be mild. You don't want it to be harsh because we don't want it damaging or irritating to the skin. We don't want it to have fragrance because fragrance tends moisturizers, creams that have fragrance in it, it tends to be irritating to the skin and it could cause the patient to start scratching. And they start scratching, it irritates the skin. They might get a cut. We don't want any of that. So we want to be mild and fragrance free. Look at the wrong choices. One person said yes to encouraging frequent hot showers. We don't like hot anything on the patient because we don't want them to burn. That's number one, right? And then number two, guess what? Hot water, that's very drying to the skin. That's another reason we'd avoid that. Five people said yes to alcohol-based lotions, and I'm sure those five people that said yes, you're thinking of alcohol, kill bacteria. Alcohol is very drying. So if the patient already has xerosis, do we want to apply anything that would dry the skin even more? No. And last, increase sun exposure. The older that you get, the more time that you spent in the sun, the more at risk you are for things such as, skin cancer and such. So increasing sun exposure, absolutely not. And guess what? That's going to be drying to the skin as well. Why would we do that? So the correct answer is mild fragrance-free moisturizers. An older adult patient reports occasional forgetfulness and slower thought processing. Why is this happening? Is it due to dementia? Is it because of increased nerve conduction? Is it because of decreased number of neurons and neurotransmitters? Or is it because of increased cerebral blood flow? The code to get in is 631-9552. 631-9552. Thank you, Anita. Okay, very good. Decreased number of neurons and neurotransmitters. So because of the decreased number of neurons and neurotransmitters, guys, this decreases or slows down, I should say, the patient's cognitive functions. When you hear that word cognitive or cognition, that means how you think. So it slows it down. So that's why when it comes to the older population, if you ask that patient a question, you need to give them time to process their thoughts, for them to process what you just said, and for them to formulate a thought. Okay, that's number one. The second important thing that you guys need to know is notice in this question, I did this on purpose. It says occasional forgetfulness, not frequent. Not constant. There's a big difference, okay? Occasional forgetfulness, because frequent or constant forgetfulness, that is not a normal age-related change. If we're seeing that, that patient's going to have to be assessed further. Something's wrong. Now, one of the options I put in there, I did it on purpose. I put dementia, and 53 of you guys chose dementia. This is a trick question. Make sure you guys know this. Dementia, first of all, this is another test question on NCLEX. You guys got to know the difference between dementia and delirium. So delirium is short-term confusion. There's an underlying cause. As soon as that underlying cause is corrected, patient's not confused anymore, right? Dementia is long-term and it's progressive. So the forgetfulness, the confusion that that patient has as time goes on, it only gets worse. Okay? That is not a normal age-related change. This is a disease. This is a disorder. Okay? So occasional forgetfulness is not dementia. You can't think it's dementia just because we're dealing with an older adult. So be very, very careful with that. How are you guys doing on the live? You put that there. Why are you trying to mess us up? Because that's what NCLEX does to you. NCLEX does the same thing. I'd rather you mess up with me where it won't hurt you than you mess up when you go take your boards. That's why I did that. Any single pitfall that you guys may get with NCLEX, I'm trying to make you get that pitfall with me too. So when you're sitting in front of that computer, you've seen that trick before and you won't fall for it. That's why. You'll thank me later. All right. Which of the following interventions can help maintain cognitive function in older adults? Would it be social isolation? Would it be engaging in puzzles and reading? Would it be avoiding new learning experiences or reducing physical activity? Very good. Engaging in puzzles and reading. So that mental stimulation, guys, it helps decrease the risk of things like dementia, and it helps decrease the risk of cognitive decline. So we want to keep that patient mentally stimulated. All right, what's a common cardiovascular change that we see in older adults? Is it increased cardiac output? Is it increased arterial elasticity? Is it decreased baroreceptor sensitivity? Or is it increased heart rate? Even if you don't know the answer, guys, I've taught you tricks and tips on how to still pick the correct answer, even if you don't have a clue. Look at your options. Very good. Decreased baroreceptor sensitivity. Now, guys, even if you didn't know what the answer was, this is a multiple choice question. You should have noticed that three of the options all have something in common, excuse me, and only one is the odd man out. Go with the odd man out. When you're looking at multiple choice option and you have no idea what the answer is, look, increase, increase, increase. Only one says decrease. If you don't know what the answer is, choose the one that's different. And I'm not saying it always works because it doesn't, but I'm saying if you don't know what the answer is, you have no clue. Take your chances. And this is the correct answer: decreased baroreceptor activity. Here's the thing: it decreases with age, guys, and that's what increases the risk of the patient having orthostatic hypotension. We're concerned about falls, that patient injuring themselves. That's why we teach a patient to make sure they dangle. We don't want them to pass out. We don't want them to fall. We teach them to change position slowly. Matter of fact, we tell them to press the call button before they even have to get up so we can help them, right? We don't want that blood pressure to drop. That decreased baroreceptor sensitivity, it causes hypo I can't speak. It causes orthostatic hypotension and can also cause the patient to have dizziness. So we're going to be concerned about injury, okay? An elderly patient experiences postural hypotension. How should the nurse instruct the patient? What should the nurse instruct the patient to do? Oh, I accidentally gave the answer. Sorry. Are you going to teach them to quickly stand up from a sitting position? Are you going to teach them to increase their fluid intake and change position slowly? Are you going to teach them to reduce salt intake? Or are you going to teach them to avoid sitting for long periods? All right. Increase fluid intake and change position slowly. That's going to help decrease that postural hypotension. All right, which of the following is a normal age-related musculoskeletal change that we see in the older adult? Would it be increased bone mass, decreased joint cartilage, increased muscle strength, or increased synovial fluid production? Very good. Decreased joint cartilage. So let me ask you guys something. You guys got that correct? Yep. That decreased joint cartilage, what does that place that patient at risk for? What disorder does it place them at risk for? The code to get in is 631-9552. 631-9552. Very good. Osteoarthritis. Nope, nope. Guys, listen, there's a difference between osteoarthritis and osteoporosis. Oh my gosh. There's a difference. Don't intermingle them, okay? When we're talking about osteoporosis, we're not talking about the muscles. We're actually We're not talking about the muscles. We're not talking about the joints. We're not talking about the cartilage. We're talking about the actual bone. And in osteoporosis, that bone's what? It's weakened. It's porous. It puts the patient at risk for fractures. That's different than the patient having decreased joint cartilage. So that decreased joint cartilage that places the patient at risk for osteoarthritis, not osteoporosis. You got to know what both of those are, okay? Okay, a patient asked how to maintain bone strength with aging. The nurse's best response. So now we're talking about bone strength, right? The patient who's at risk for osteoporosis. Okay. What would you teach them? Increase dairy and vitamin D, avoid weight bearing exercises, reduce protein intake, limit calcium intake to prevent kidney stones. Thank you, Stella. Okay, very good. Increase dairy and vitamin D intake. So you're going to teach a patient to increase calcium. Dairy is full of calcium. Calcium is what makes the bone stronger. Here's the thing, guys. You can ingest as much calcium as you want. It's not going to be absorbed without vitamin D. So that's why you're going to be eating foods high in calcium, taking calcium supplements along with vitamin D. Calcium is as important for the bone strength, but vitamin D is what makes you absorb the calcium. Okay. Now let's look at the wrong answer choices. 9 people went with avoid weight bearing exercises. No. To strengthen the bones, you want weight bearing exercises. And here's why. Weight bearing exercises forces calcium that should have been in your bones in the first place, but the calcium has been hanging out in the bloodstream. When you do weight bearing exercises, such as you go walking, what it does is force that calcium that was hanging out in the blood to return back to the bones where it belongs to make the bones stronger. So we want weight bearing exercises. Reduce protein intake. No, protein intake is very important, especially for the older adult. Protein is important for building muscle mass, but protein's also good for what? Wound healing, right? And last, limit calcium intake. Absolutely not. We want the patient to increase calcium intake. Okay, decreased ciliary function in older adults increases the risk of pneumonia. Is this true or is this false? I just realized you guys can't see the question. Decreased ciliary function in older adults increases the risk of pneumonia. True or false? Huh, that's weird. I'm sorry, guys. I don't know why you can't see that on the screen. I'm not sure why that happened. But the correct answer is true, guys. Decreased ciliary function absolutely does increase the risk of pneumonia because you got to think about, all right, Um, decreased ciliary function in older adults, it does increase the risk of pneumonia. And you guys have to think about the function, the ciliary action. It helps move all that crap out of the lungs, right? Because we're talking about the lungs right now. So if the ciliary function is declining, that means mucus, foreign matter, any crap that shouldn't be there is just sitting there. And what happens? Bacteria starts to grow and boom, infection sets in and patients got pneumonia before you know it. Right? So with decreased ciliary function, you're going to have decreased mucus clearance and you're going to have an increased risk of pneumonia. Is your Kahoot still frozen? Okay, good. Okay, older adults should be encouraged to obtain the annual influenza and pneumococcal vaccines. Is this true or is this false? Older adults should be encouraged to obtain annual influenza and pneumococcal vaccine. True or false? True. This is true not only for older adults, but anyone who's immunocompromised. Okay. Now, with the older adults, their immune system is weakened, right? So it puts them at risk for infections. So older adults absolutely need to be the first in line. However, anyone else that's immunocompromised, anyone with HIV, AIDS, patients who are, cancer patients that are getting chemo or uh, radiation. Now, this one, there's a nuance to it. Okay. So, these type of patients, they can't get any live vaccinations. Um, any patients with autoimmune disorders, patients with sickle cell anemia, any patient who is at high risk, they need to be the first ones in line getting their flu vaccine and the pneumococcal vaccines. I think there are two more questions on this Kahoot. We're almost done. All right, which intervention helps prevent urinary incontinence in older adults? Is it decreased fluid intake, encouraging Kegel exercises, restricting bathroom access, or encouraging diuretics before bedtime? I forgot to put my E there, but that word says encouraging. Very good, she's royal. Very good. Yep. Encouraging Kegel exercises. Why? It strengthens the pelvic floor muscles. That's exactly why. And so it helps with the urinary incontinence. Decreasing fluid intake, we are not going to do that. Let me tell you something. The older adult already has a decreased sense of thirst. That's why they're at risk for dehydration. That's why you have to constantly remind them, please drink fluids. That's why you always have to have a cup with a straw right in front of them to remind them to keep taking sips, okay? Because they're at risk for dehydration as it is because they tend to lose their sense of thirst. You're not going to restrict bathroom access. Restricting access to the bathroom, how's that going to help them with incontinence? It's not. And then last, encouraging diuretics. If anything, that's going to make it even worse because they're going to feel like they need to urinate more. Okay. And I think this is our last one. Which visual change is commonly associated with aging? Myopia, presbyopia, increased tear production, improved night vision. No, there's one more after this. Yes, bladder training also helps. Absolutely. You have the patient, you encourage the patient to go use the restroom certain times of the day, X amount of times, and so they're actually training their bladder to empty at various intervals. Absolutely. Presbyopia. That's the correct answer. So, guys, as the adult gets older, they have a much harder time focusing on objects that are closer to them. And the reason for that is because of the change in the lens. Okay. It's not myopia. Myopia is nearsightedness. They do not have that. right? As they get older, they actually have the opposite. They have a hard time focusing on objects that are closer to them. Again, this has to do with the changes in the visual lens. You're welcome. Okay, one last question and we're done. Which taste change is common in the elderly? Is it increased sensitivity to salty foods, decreased taste bud function, enhanced sweet taste perception, or increased olfactory sensitivity? Very good. Decreased taste bud function. This is very true. Bonus question. What are the two tastes that is decreased the most in the older adult? What are those? What are they? Very good. Sweet and salty. Sweet and salty. So that places them at risk for diabetes because of the sweet. It's hard for them to taste the sweet, so they want more of the sugar to taste it, right? And it places them at risk for hypertension because their taste for the salt has decreased, and so they tend to put more salt on their food so they can taste it. So it places them at risk for both the diabetes and the hypertension because of the decreased taste of sugar and salt. Very, very good. All right, let's see how you guys did.